The CareMobile, a doctor's office on wheels, serves children between the ages of 3 and 18 in Chicago, Illinois, and surrounding suburbs. Funded by Advocate Children's Hospital and Ronald McDonald House Charities, it provides a range of services, including chronic care for conditions such as asthma, as well as physicals and vaccinations. The mobile unit, like many providers, switched to electronic health records this year. Nurse practitioner April Amon explains how care is delivered and documentation is completed when she and her medical assistant hit the road.
So when we first got started with our electronic medical record, IT was very involved in the process. We have something called Advocate Workspace, which we all need to be consented, I guess, to have access to, and that goes through IT. So this means when I'm out at a school, not in the vicinity of the hospital, I have a login and a password where I can log onto our Advocate Workspace and get onto our EMR. So they were very involved in setting that up for us. Also just setting up our CliniCare notes. So CliniCare is the EMR that we use. The note is what I chart on the patients with. So they were very good with setting up the notes and speaking with me and figuring out what I wanted on there so we can make it easy with drop boxes and sorts of things like that. The transition to an electronic medical record definitely changed our workflow on the mobile unit. With any change, it was something we had to get used to. There's definitely a few more steps that we have to take now. However, we've been doing it since January, and I would say that we're already pretty efficient. The number of kids we've seen has unfortunately gone down just a little bit. But the way we're storing that information and the care we're providing has improved. So if you look at it from that angle, it's much better. But it was definitely a transition that we had to get used to. How we maintain and reserve the HIPAA release forms is every time we schedule a school visit, we have a consent form that gets sent out. And the parents have to fill out that consent form and sign it. And by doing that, that is saying that we can see these children on the mobile unit and that we are giving them our okay and are saying that their information is going to be protected while they're on the mobile unit and even after they're not seen. Same goes with vaccinations. The parents are aware that the vaccines are being entered into an Illinois database, so they give permission for that. And we will not see anyone without that signed consent form. As far as HIPAA goes on the mobile unit also, we try to keep everything private. So we have our screens that will black out at a certain point. We always have the laptops facing us. And we limit the amount of students that are on the mobile unit at one time.
This has been Mary Butler reporting for the Journal of AHIMA.